We're back 33 minutes past the hour. Dr. Bob, if you would do the honors of introducing your distinguished fellow CEO.
I will. Thank you for that compliment,
yes.
Harry. The scale's a little different, but Doug Tieman is the CEO of Caron. Caron is an alcohol and drug treatment program, and really not just a program, it's really an institution located in Wernersville, Pennsylvania, just outside of Reading. They call it Magic Mountain in the vernacular. Good morning, Doug.
Hey, Doug, are you there? Hold on, Doug. Well, I promise you we're going to hear you this time. That was not your fault. Good morning, Doug. You're on the air.
Oh, good morning. Well, thanks so much for having me. I really appreciate the introduction, and it is nice to hear Bob talk about Caron and in Wernersville, Pennsylvania, which is where we're headquartered, but as one of the oldest and largest nonprofit treatment centers in the country. We also have facilities in Florida and then offices in Boston, New York, Philadelphia, Washington, D.C., and Atlanta, Georgia.
Wow.
Doug, I met Doug earlier this month at the NCADD National Conference in Washington, and I've been impressed by Doug's career for the last several decades. I've been a friend of Casey Duffy's for 3 decades, and Casey is the chairman of the board, I believe, right now at Caron. And
that is correct.
And
yeah.
I've been, some friends with him, and his father John was the chair prior to that at some point. And so when Doug came on board, I've been following you. I would say, internet stalking might be appropriate, but Doug, it was a pleasure to meet you earlier this month, and I really appreciate your calling in this morning just to talk about Caron. You have a very long history. 1957, founded as Chit Chat, wasn't it originally?
Correct. Yeah. Dick Caron, who had gotten sober in 1950, really dedicated his life to helping other alcoholics get well. It's kind of interesting. In Berks County, he's considered this great philanthropist and humanitarian, and his daughter would say that's true, but his whole goal was to stay sober, and he knew that for him to stay sober, he had to give it away. So actually, 1957 is when we were incorporated as Chit Chat Farms, which means next year we will be celebrating our 60th anniversary.
Wow.
And as I mentioned, one of the 3 oldest addiction treatment centers in the United States, having gotten started in the 1950s.
And I imagine Hazelden is one of the other 3, and maybe Father
Correct.
Martin's. I don't even know what the third is.
Hazelden was the first, 1949, found in the fall of 1949. Dick Caron got sober there in February of 1950, so he was one of the first patients at Hazelden and really wanted to bring that to the East Coast. The other one is Willing Way in Georgia, is the other one. And then Alina Lodge, which you probably might know.
That's right here in
Northern New Jersey, followed shortly after Chit Chat Farms. And the neat thing in the early days, all those men and women that started those early facilities were, there was a small band of them. They're very collegial, very supportive of each other, and we still are, particularly in the nonprofit world today. There's so many people suffering from this disease that we want to work together to help those that have not yet found the path to recovery, because it's a wonderful life on this side. And we want to just help as many people as we can get that wonderful life that comes in recovery.
When I got sober in 1986, I think it was still called Chit Chat. And I've been out there several times, not as a patient, but as a visitor to other patients. I've brought clients there, brought patients there, driven that the long, I forget what they call it, the long road or the
John Debbie calls it the long ride. The long ride.
It wasn't a long ride for me, but for the guy in the back seat, it was a long ride. And that's I've been around the Duffy family for so many years that I've heard all these stories, and I've been out there several times, as I said. And I also have toured Hazelden. I've toured Father Martin's Ashley. I've toured the Betty Ford Center in Rancho Mirage. I mean, when I travel, I'm kind of a groupie for old treatment centers and long-lasting and famous treatment centers.
And, well, you really hit, I think, the most well-known of the nonprofits, and all of us have an extremely close collegial relationship. The current CEO at Father Martin's, Father Mark, is a former Caron employee. We have very good friendship with him. Mark Mishek at Hazelden, very close relationship with him. And as you probably know,
they merged with Betty Ford, right?
They took over the Betty Ford Center. So We work very collegially together. In fact, Mark Mishek, the president of Hazel, and I just published a paper which is coming out almost immediately that you'll be able to get on our website about centers of excellence in the addiction treatment field. That we're really challenging the field to have a number of components that really are the hallmark of great treatment. And there's a lot of real basic things in there, like be accredited, be licensed, have staff that are credentialed, have a specific staff-to-patient ratio, use evidence-based treatment protocols, do follow-up, publish your outcomes so that it's not a mystery. Highlight the clinical part rather than the sheet count or the thread count of your sheets.
Right.
We really try to focus that, and we encourage we're trying to encourage everybody. The beauty of the website is that, or the internet today, is that everybody can get information instantaneously. The downside is it's not always accurate. So one of the things that we're really trying to encourage people, when you make that really, sort of tough choices, family decisions, when someone is impacted by this disease, and you start, looking at different facilities, you might want to just look at this paper on centers of excellence to just kind of look at all of the ingredients that a treatment center should have, so that as you think about sending someone somewhere, obviously those with more of those ingredients is going to give your loved one a higher likelihood for a successful outcome.
I'm glad you brought this up, because there's been a proliferation of inpatient programs, as you well know. Many of them are for-profit, and I don't want to highlight any or or even give an example of where they might be. However, we operate an outpatient addiction treatment program. We are nonprofit, but however, we don't take any insurance. We don't really have self-paying clients. It's mostly fee-for-service, state or county funded. But when someone calls me or calls our center and they have insurance, or they're a self-paying client and then inpatient is indicated, and I'm not a clinical person, but if I believe it might be indicated and they may get an assessment at our place or somewhere else locally, I always refer them to Caron. It's my top choice within a day's drive, certainly, or it's probably 4 hours from here. It is. I mean, we have Seabrook House, and I don't want to disparage Seabrook House. Ed Deal is an old colleague of mine. I met him in 1992. However, Caron just rises to the top, and I do love Seabrook House. So if somebody is local and doesn't want to go to Pennsylvania, I always say Seabrook House, certainly.
Yeah, Seabrook does a great job, and again, they are a nonprofit organization. And one of the things that you'll see with every nonprofit is kind of the tagline that we have at Caron is we talk about recovery is our only bottom line, which is a real differentiator from the private equity groups. They clearly have a heart. They clearly want to help people. But at the end of the day, their bottom line is the bottom line. Last year at Caron, we gave away over $16 million in charity care to help people who couldn't afford to come to Caron. Can you imagine a private equity group doing that?
No.
That's my investors' earnings, but because we did well, we raise a lot of money every year. I say being president of a nonprofit means I'm a professional beggar, so I get to ask people for money so I can give it to people who need to get help. And one of the things that I think for any of us, and I know you have the same feeling, Bob, is being able to help people who are truly desperate, and that's, unfortunately, addiction makes the individual and their families truly desperate, and be able to help people regardless of their financial situation is just something that every day gives me great joy.
It is nice to be able to go to work and know that you are, in many ways, helping people recover, helping families recover, getting people back to their communities, to their jobs, to their spouses, their children, and becoming productive members of society. And I mean, it's fascinating to me that you have $100 million budget roughly, and 16% of that is scholarship. And so, I mean, you must be doing a really fabulous job, incredible job at fundraising, and of course with your whole team, development team, and the board, and all of your amazing alumni resources as well. And so that is something like a university or a college would have that kind of tracking. That is very useful, because obviously if your alumni are doting, they're still recovering, they're still sober. They wouldn't have that money, and they wouldn't be sending you a check every year or going to your events if they weren't sober.
One of the things we are very proud of is our alumni. Caron raises more money in the addiction treatment field every year than any other treatment center in the country, which I think is a real hallmark to two things. One is our alumni, but the second is just the culture of philanthropy we make it real clear to everybody that comes to Caron that we are a nonprofit. We're able to do what we do because people before you have given, some maybe just a little, some a lot. So that, and part of the expectation when you walk out of here is that you'll do your part, whether it's service work, whether it's volunteering, whether it's writing a check. We have an expectation that you'll do something, kind of like what Dick Caron did. For him to stay sober, he knew he had to give something back. We tell people you don't have to start a treatment center like Dick Caron did, but you can do something
in your own. Yeah, Doug, we have to take a very short time out. I want to ask you about your book. And then I just want to follow up on a couple of programs there that you have. We'll be right back after this break.
Hi.
Thank you, Harry. We are back with Under the Influence. It's a program sponsored by Atlantic Prevention Resources twice monthly on the second and fourth Friday of the month from 9 to 10 a.m.
Tuesday even.
Tuesday.
It's okay.
All right.
Did I say Friday?
I'm just here to help. I'm not from the government. I'm just here to help.
Thank you, Harry. And we're visiting with Doug Tieman. Doug is the CEO of Caron, which is a treatment program headquartered in Wernersville, PA, outside of Reading, founded in 1957, one of the granddaddies, if you pardon the gender, of the alcoholism and addiction treatment field, a nonprofit with a location in Florida and offices in Boston, New York, Atlanta, D.C., and Philly. Is that correct?
Correct.
And really, a huge fan. I went to Strecker myself, which was in West Philly.
I remember it.
You talked about the internet, and you talked about people looking for places. And, of course, there are billboards. I drove someone to the airport yesterday in Philly. There are billboards all up and down the Atlantic City Expressway, the 42 freeway, on the bridge, on the Walt Whitman Bridge, on 95 for treatment programs, many of them in Florida. And if you go to their websites, you see beautiful pictures of palm beaches and sunsets, palm trees on beaches with the ocean, and it's gorgeous. If you were to go to Caron's website and look, there probably isn't a picture of the view, but it's at the top of a hill outside of Reading. It's not very picturesque. It's tree. You see a lot of trees. Yeah. But the point is that what you're going to get there is real recovery.
It's what they do.
And that's what they do, and that's what they've been doing for almost 60 years. Isn't that right, Doug?
Correct, yeah. And that's, again, one of the things that in the paper that you'll really see that Mark Mishek and I wrote, kind of highlighting what you should look for in a treatment center. I also have another thing, and I really encourage people, if you want to look and kind of investigate treatment, go to our website, caron.org, where you'll be able to get the document that Mark Mishek and I wrote. There's also something that I sent to all the presidential campaigns, what every presidential candidate and legislator must know about addiction treatment. And quite frankly, it's good for anybody to know, just kind of the things of what should you look at. And one of the beauties of philanthropy, in addition to helping us provide care to people who can't afford it, it really provides the capital for us to have terrific programs. And I know you wanted to talk a little bit about the programs, but we would not be able to do all of the gender-separate, age-separate, profession-separated programs if we didn't have the financial resources to do that. And we wouldn't be able to do the research that we've been able to conduct with particularly University of Pennsylvania, Penn State, Hershey, Thomas Jefferson University, and to some degree with Brown, to see what works. We've followed over 15,000 patients over the last decade just to identify what's working and what's not working, and a very costly enterprise. We've spent millions of dollars doing that, but our interest is recovery for life, and we continue to try to raise the bar on why do some people get it and some people don't, and our challenge is to continue to come up with new strategies and protocols for that population that have difficulty recovering. Because
it is an illness that is characterized by chronic relapsing in many cases.
Correct. And yeah.
I applaud you. Since I earned a PhD from Temple University, my dissertation research was about alcoholism and stress. And I would love to send you an abstract of that for your information. But I applaud you in doing this research and following these patients, because this is something that 20 years ago even was unheard of. And it's cutting edge for you to have started this 10 years ago research and tracking a longitudinal study of clients and what works and what doesn't work. And I mean, part of my dissertation research was on how stress affects recovery, and that people who cope with stress better are more likely to stay sober than people who don't have those appropriate coping mechanisms. So I'm going to read that paper, the Mark Mishak and Doug Tieman paper that is on your website at Caron.org. What is the phone number? I understand you have a 24-hour phone and live phone answering, not a service, but a referral assessment program, an intake program. What is the number for people to reach?
It's 1-800-678-2332. And we have people staffing it all the time. Again, one of the things that we believe this is extremely personal, and making sure we have a person on the phone when you call, not start having to punch all different kinds of numbers based on what you want, because we think families are challenged. Talk about stress. They're really stressed when they're beginning to reach out to treatment center. We always kind of say nobody calls us because they're on a winning streak. Right. People call us because there's some type of calamity that's happening in the family.
Devastation, not just calamity, but devastation. And luckily they'll call a place like Caron first because they won't get a runaround. They're not going to get put on hold or transferred or referred to another location.
That's exactly right, and that's something that we made. Again, when kind of all the punching numbers was kind of in vogue about 10 years ago, we just kind of someone came and made a presentation about how much money that would save us, and we'd say, but at what cost? I mean, you got desperate people. They need to be able to talk to somebody and vent and share their frustration so that we can try to begin to provide them with the right guidance, whether it's at Caron or whether we're making a recommendation that they, seek help somewhere else. We want to have a live person there who's an expert to help them. We think that's key. Because
your intake staff do appreciate and understand that Caron may not be the best place for all individuals, obviously.
Correct. We have a belief that we never know how many opportunities people will have at recovery. So our goal is for your first one or the one you're currently embarking on needs to absolutely be the best fit. And again, it's one of the real nice things about being a nonprofit is that we don't look at this as a marketing business. We look at this as a life-saving business. And if we're not the best choice, we're going to readily recommend you to other facilities. And again, particularly in the nonprofit world, the facilities that you just mentioned before, Hazel and Betty Ford, Father Martin's Ashley, Seabrook, all of us readily refer to each other if we think that someone will do better in a particular setting that each of us have.
Because there's that collegiality and there's that understanding that if you can help somebody, at least they should go somewhere like your place. Like Caron, right?
I got interviewed recently by Behavioral Healthcare magazine about the outcome study that we've been conducting with the University of Pennsylvania, and was helped established by one of the original directors of the National Institute on Drug Abuse, and the interviewer asked me, said, why did you do this? And I said, because we want to know how well our patients do. We want to know what is working, and just as importantly, what is not working. We continue to be concerned about the person that doesn't get sober. How do we help them? She said, well, that's an interesting answer. So you're doing it because you're really interested in outcomes and quality of care. And I said, absolutely. And she said, well, I just interviewed someone from a for-profit place that also does outcomes, and they said they did it for marketing purposes. And I think and there's nothing wrong with that.
That's the difference, right?
It's just a fundamental difference in the nonprofit side of this. And I have a lot of friends in the private equity world, and I encourage them. I said, please make contributions to the nonprofits, because Bob, you and I have been at this a long time. We know that this ebbs and flows, and we saw a great boom in the addiction treatment field at the late 80s, and then it all came crashing down in the 90s, and who was left standing? The nonprofits,
right?
Because this is what we're going to be doing. If you went and looked at the names of the for-profit treatment centers of the late 80s, most of them are gone, just like many of the ones that are around today. When this right now it's great. The government is funding. There's a lot of awareness. Politicians talk about it. We've got the Comprehensive Addiction Rehabilitation Act. We have a lot of good things going on right now. Unfortunately, if history repeats itself, they'll, at some point in time, there'll be an ebb, and those that are in this for profiteering will say, okay, let's move on to something else. But you know what, Bob, your organization will be here, we'll be here, Hazel will be here, Ashley will be here, Seabrook will be here. So make sure you support your nonprofits, because we're the ones that stand the test of time, because this is what we do. We help addicts get well.
And that's the reason that we purchased our building where our outpatient treatment facility is located, because if we were to experience a loss in funding or cuts, that we would be able to operate on a shoestring as we are now and help more people. I do respect the fact that you're taking treatment dollars that you could be using to help people and putting it towards research to improve outcomes. I do, that's a tough call, because that's like overhead. That's like G&A. That's not money that is going to help people. But in the long run, it will save lives. It will improve outcomes, and it'll make people have longer and better sobriety.
I'm glad you mentioned that, because I was actually just last week down on Capitol Hill meeting with the two senators from Pennsylvania and our senators from Florida. And I said, I'm not here for a dime. All I want to do is make sure you spend your dimes well, because, again, if history repeats itself and we don't do a good job spending the dollars that are now available to help people get sober, eventually, if we don't do it well and we don't have good outcomes and people don't get well, society eventually says,
we're not paying for this.
Helping?
Right.
Why are we helping? Why are we helping? Put them in jail. So this is the next 5 years with CARA and all of the other additional interest in funding addiction treatment, as we need to make sure that there are good outcomes, that there is follow-up, that people do research. And again, University of Pennsylvania has really helped us develop a really effective program, and we have the results on our website. We're one of the few treatment centers that actually puts it on the website, because this isn't makeup, this isn't self-report, this isn't a marketing ploy. We have bona fide, an organization, a premier academic institution like the University of Pennsylvania that, is willing to have their name associated with this. And it's really interesting. Using a chronic disease model as we do at Caron, we have found that those individuals and we followed about 8% of our total patients. We're moving it up to 15% this year, because it is extremely costly, as you pointed out. Costs us about $7,000 per patient per year to follow them. I mean, we get 4 people around them reporting on how they're doing, and we do randomized urine drug screens over the course of the year. And we find that, first of all, we're able to follow everybody for the whole year, which is so much different than the self-report follow-up phone calls where you might be lucky to get hold of a third of the people at the end of the year. So we know what everybody's doing, and we find that, frankly, 59% of the people have been continuously sober for the whole year. Another 20% are sober at the end of the year, bringing, 1 year later, 79% of the folks are sober, which is really quite remarkable.
That's astronomical.
For a chronic illness, and an additional 14%, bringing the number up to about 93%, that'll say, you know what, life's a whole lot better. For those that weren't able to.
So they've at least reduced or curtailed,
right. Correct. They've reduced consumption. They don't drive after drinking. They don't drink before going to work.
Or they've had periods of abstinence, and at least it's better than no abstinence, right?
Correct. So, so our view is, from a chronic illness perspective,
93%.
This is really remarkable from an improved quality of life. But granted, there is a level of Hawthorne effect that goes with this. These folks know they're being tracked. They know they're accountable. But, quite frankly, we think that's a good thing.
There's nothing wrong with that. Nothing wrong with that at all.
Exactly. So those are the kind of things that we think are real important, and I've shared that with some of the folks at Capitol Hill. The biggest problem that oftentimes we see with the publicly funded dollars is that people don't get enough. I use the analogy of a chicken dinner. Chicken will feed 4 people, but oftentimes at the public level, we try to have 24 people go to that one chicken dinner and everybody leaves hungry. I said, we'd be better off making sure that those that are getting help get enough help and get treated for a chronic illness. This is not an acute episode. Don't give people 30 days or 90 days and think they're cured, because they're not.
Doug, in the minute or so we have left, minute and a half, I'd like you to talk about your book. I just read about it, Flying Over the Pigpen, Leadership Lessons from Growing Up on a Farm. I understand you grew up on a hog farm in the Midwest. Is that right?
That's correct. Yeah, the book came out. You can get it on Amazon.com. I think it's only $13. I've told people I'll hand sign an autograph, and then it's probably worth 10. But the information in it is really it's simple, but like a lot of things in life, it's simple but hard. But basically, my dad told us a lot of lessons about how to be successful. So every chapter starts with a story, which is kind of quaint, funny. And then there's a lesson, and then we talk about the tools. And it's how to be successful in whatever you're doing, whether it's job, life, or even recovery. I love using this book as a recovery tool for folks as well. If you follow the lessons in this, you can have a wonderful life. And the Flying Over the Pigpen, I said all of us start somewhere. I started on a hog farm, so my goal was to fly over that, so it's not meant to be derogatory. We all start somewhere, so the book will help you maybe just achieve a little bit more in life.
And you, as a child, you wanted to be a CEO of a major corporation by the time you were 40. And so you met that goal. And congratulations. I wish you the best. This was a great interview for me, at least. You're a great interviewee. I really appreciate the time. And I would love to sit down, have a cup of coffee with you, lunch or something, if you're ever down in the Atlantic City area.
We'll do that. I'll grab Casey Duffy and we'll come over.
Absolutely.
And thank you much. I'll do that. And if any more information on Caron, it's caron.org. And we're always here, just like you, Bob, to help anybody in need.
Thank you, Doug. And the toll-free number is 1-800-678-2332.
Doug and Dr. Bob, great program. Until we meet again, Dr. Bob.
Thank you, Harry.
Thank you, sir.